Okay, so this is our last video and it's on the ankle and the foot. So looking at the foot, we have the phalanges, metatarsals, and the tarsals. So on the phalanges, we have the distal, middle, and proximal. Then we have 1 through 5 on those along with the metatarsals. Looking at the tarsals here, we have the medial cuneiform, the intermediate cuneiform, the lateral cuneiform with the cuboid, and we have the navicular, and we have the talus and the calcaneus. Here's a sagittal view. So looking here, we have a facet for the medial malleolus on our talus. Here is our calcaneal tuberosity on our calcaneus. We're looking at the navicular, the medial intermediate cuneiform with the medial cuneiform, and here's the first, second, and third metatarsal. Here's your first proximal phalanx and your first distal phalanx there. So looking at the other side, so here's our talus, and here's the facet for our lateral malleolus, our navicular, intermediate cuneiform, lateral cuneiform, and the cuboid, and then we have 5, 4, 3, 2, 1 on our metatarsals. Looking here, we have our medial longitudinal arch here, and then we have our lateral longitudinal arch, which is obviously going to be lower on most people, and the transverse arch is the one coming across towards us. Here is a diagram of a sagittal foot and ankle. So here is the tibia. We have the extensor hallucis longus muscle with our talocrural joint, which we can also call the mortise. The neck of the talus, we have the head of the talus. Here's our navicular with our intermediate cuneiform, and our tarsal metatarsal joint. Right here is the tendon of the fibularis longus muscle, and then here's our second metatarsal. So the base of the proximal phalanx, here's your metatarsal phalangeal joint. Your first dorsal interosseous muscle is there, and your abductor hallucis muscle right there. So when we come across here, we have a spring ligament right here. A lot of radiologists like to see that when we're scanning feet. So coming across here is your quadratus plantae muscle with your talar calcaneal navicular joint right here. We have your flexor digitorum brevis muscle with your plantar, well, I don't want you to know that. Here's your subcalcaneal fat pad and your calcaneal tuberosity on your calcaneus and your interosseous ligament. That's what we're going to be calling it, just the interosseous. Here's your Achilles tendon, and your subtalar joint is there. This is the body of your talus. This is your flexor hallucis longus. So you have your extensor hallucis longus with your flexor hallucis longus on the back side. So looking here is your tibia, the body of your talus. Posterior facet, you have your sinus tarsi with your interosseous ligament with your medial facet, and this is your acetabular facet, and the head of your talus and the talar calcaneal navicular joint. And then this is the neck of your talus. There's a little divot there. This is your extensor digitorum longus with your extensor hallucis longus. Looking at a CT, reformatted in sagittal plane. It's your tibia, calcaneus talus, posterior subtalar. You have your sinus tarsi, your calcaneus, your tuberosity of your calcaneus, cuboid, calcaneal cuboid joint with your talo calcaneal navicular joint there. So we'll look here, you have your talus, medial malleolus, there's your lateral malleolus, and this here is your tibialis anterior tendon with your extensor hallucis longus with your extensor digitorum longus, and back over here you have your flexor digitorum longus and your flexor hallucis longus. So here's your peroneus brevis and your peroneus longus with your Achilles tendon. All right, so here is a coronal cut. We have your tibia with your epiphyseal line, and you have your talocrural joint or your mortise joint. Here's your medial malleolus. I want you to know your flexor digitorum longus and your tibio posterior muscle and your flexor hallucis longus. Right here is your interosseous ligament. Coming around, this is your calcaneus. I want you to know your, let's see, I don't make you know all of it, thank goodness, right? Here is the lateral malleolus and, of course, your talus. So your mortise joint, tibia, talus, calcaneus, and your middle subtalar joint there. Look in here, we've seen this one before, so talus, medial malleolus, lateral malleolus, so talus, and this is your lateral malleolus with your medial malleolus on a axial T1. So looking here, we have your third, second, and first metatarsal with your tarsal-metatarsal joint, your medial cuneiform, intermediate cuneiform, lateral cuneiform with your navicular, and your cuboid with your calcaneus. And there's just a piece of your talus. So looking here, you have first, second, and yep, just your first and second metatarsal with your medial cuneiform, intermediate, and lateral. And here's your navicular, your talus, your middle subtalar joint. And I want you to know your calcaneus and your posterior subtalar joint with your talus. And right in here is your sinus tarsi. Kind of hard to see it. First metatarsal, medial cuneiform, lateral cuneiform. And here's your cuboid, your calcaneus, your third metatarsal, second, and first. Looking here, you have your first proximal phalanx with your first metatarsal phalangeal joint. Here's your first metatarsal, second, and your third. In between is your intermetatarsal joint, and you have your medial, intermediate, and lateral cuneiform, your cuboid, and here's your calcaneus. So tibia, here is your mortise joint with your talus and your calcaneus. There's your fibula. So tibia, lateral malleolus, your talus, your middle subtalar. You got to look where we're cutting so you can get an idea where we're at. I want you to know your calcaneus, and here's your sinus tarsi. Look, coming forward here, we have your navicular, your cuboid, and your fifth metatarsal. Coming further anterior, we have your navicular, lateral cuneiform, cuboid, and fifth metatarsal. Further anterior, medial cuneiform, intermediate, and lateral cuneiform. Use your cuboid and your fifth. So first metatarsal, second, third, fourth, and fifth. Here's a sagittal cut. So we have the tibia, the talus, your subtalar, posterior subtalar, calcaneus, your sinus tarsi. Here's your sussinaculum tali. We just call it the calcaneus. Don't worry about that. So here is your middle subtalar, navicular, medial cuneiform, first metatarsal, sesamoid bones under there, and here's your first proximal phalanx. So here's another sagittal. We have your tibia, talus, calcaneus, sinus tarsi, your cuboid, lateral cuneiform. This is your middle cuneiform, and here's your navicular. And we've got your second metatarsal and your metatarsal phalangeal joint. So third metatarsal, lateral cuneiform. We have your tibia, lateral malleolus, and we have your talus with your calcaneus. Just a piece of it's kind of a strange cut. Here's your cuboid. It's a great view of the cuboid. So there's your fourth metatarsal. So this is just kind of showing you how your ankle is all put together. So when you twist your ankle, there is a lot of things that tear. It's actually better just to break the bone because the bone will heal compared to all the tears. You'll have weakness in your ankles forever. So tibialis anterior tendon with your extensor hallucis longus with your extensor digitorum longus. Here's your peroneus brevis and peroneus longus with your Achilles tendon with your flexor hallucis longus, flexor digitorum longus. So if you look, your flexor digitorum longus is directly across where your flexor hallucis longus is straight up above, or straight below the extensor hallucis longus. So it makes it a little bit easier to remember how it's all put together. So this over here, the PTT, is your posterior tibialis tendon right there. So posterior tibialis tendon, here's your spring ligament there. Peroneus brevis, peroneus longus, Achilles tendon, your flexor hallucis longus with your flexor digitorum longus. Coming across here, you have your medial cuneiform, intermediate cuneiform, lateral cuneiform with your cuboid. and your peroneus brevis muscle, or tendon, I should say. So it's black, so it's tendon. Here's your calcaneus with your Achilles tendon right there. Here's your quadratus plantae muscle with your spring ligament is right there. The other ones I wouldn't ask you to label. So your flexor hallucis longus tendon is right there. Here's your fifth, base of your fifth. Your adductor digiti minimi muscle. I like the name of it. I usually just call it the minimi. So if you hear me just refer to the minimi, that's what I'm referring to, is your abductor digiti minimi muscle. So here's your calcaneus, your flexor digitorum brevis, and your quadratus plantae with your digitorum longus tendon. Kind of hard to label those two. So here's your fourth metatarsal, your cuboid, your spring ligament. That's a great shot of it right there. Your peroneus brevis tendon with your peroneus longus, your calcaneus, your quadratus plantae muscle. That's a great shot of it. Your adductor hallucis muscle. So looking here at a sagittal, this is medial. This is your posterior tibialis tendon right there with your flexor digitorum longus, your flexor hallucis longus. You can see how it spreads out there. And this is your tibialis anterior tendon. So this is your tibia, talus, navicular. We're looking here at your flexor hallucis longus, so it's coming down and we're catching the rest of it right there. Here's your Achilles tendons, and this is your quadratus plantae muscle. So we have your tibia, your talus, your calcaneus. We have the soleus muscle, and back here is your Achilles, that black line. So posterior facet, medial facet, here's your interosseous muscle, here's your acetabular fossa with your navicular, your cuboid, your lateral cuneiform, and your medial cuneiform, your extensor hallucis longus with your extensor digitorum longus. So now we're heading out lateral. We're coming around. Here's your peroneus longus with your peroneus brevis. So tibia, talus, calcaneus, fibula. So we're looking here. This is your anterior talar fibular ligament right there, peroneus longus, and we have your adductor, so the mini-me muscles. Adductor hallucis muscle and your quadratus plantae muscle. Flexor hallucis longus, flexor digitorum longus, and the PTT there is your posterior tibialis tendon. So we have your tibia, your talus, your calcaneus, and these are your deltoid ligaments here, and I'll show you what those look like in a minute. Posterior anterior tendon with your extensor hallucis longus, your extensor digitorum brevis muscle. Here's your navicular, your cuboid, and just look where we're cutting so you'll be able to label it. Your cuboid, you have your peroneus longus tendon, peroneus brevis tendon, your mini-me, and your plantus asperoneus. That's kind of a hard one. Your flexor digitorum brevis muscle with your quadratus plantae. And this is a good shot right there of your tibialis posterior tendon with your abductor hallucis tendon. It's pointing at a muscle, so that's actually the muscle. So cutting further anterior, we have your tibialis anterior tendon with your medial cuneiform. Your extensor hallucis longus tendon is right there with your intermediate cuneiform, lateral cuneiform, fourth metatarsal, and your fifth metatarsal. I'd have you label the flexor digitorum brevis muscle there. All right, so first metatarsal, second, third, fourth, fifth, and we're looking at the interosseous muscles. Just like on the finger, you have the interosseous muscles. So down below, you have your flexor, your mini-me muscle, your digitorum brevis, and I want you to know your flexor hallucis longus muscle, and then you have your abductor hallucis muscles. I just know that those are there. All right, so your deltoid ligaments, so you can see where they're at and how they hold it all together. So there you can see them on MRI. That's why I want you to be able to label them. So between the tib fib, just like in the forearm, you have the interosseous membrane, and you can see how the ankle is all put together. So looking here is your patella, your gastrocnemius, you have your extensor digitorum longus, tibialis anterior, your extensor hallucis longus coming down here. I want you to know course, your fifth metatarsal, your extensor digitorum brevis, and you have your lateral malleolus, flexor hallucis longus with your peroneus brevis muscle there, and your soleus is just under your gastrocnemius and the head of your fibula. So looking here, you have the tendon of your flexor hallucis longus and your flexor hallucis brevis on either side, your flexor digitorum brevis, your abductor hallucis with your abductor digitorum mini, so mini-me right there, and your flexor mini-me brevis. So these are your minis. So dorsal interosseous and plantar interossei. So your muscles in between there. So I wanted to show you what they look like here. Here's your dorsal interosseous in between each, okay? And then you have your abductor hallucis, your flexor hallucis, and your adductor hallucis. So just hallucis is fine. Here's your plantar interosseous here. So vessels of the lower extremity. We have the aorta. Remember, it bifurcates into the common left and right. Coming down into the internal external. Once it goes through the pelvis, then we're in your femoral artery. Okay, so here is a CT3D coming down. This is an angio. This is your celiac trunk, and then you have your superior mesenterics with your renals coming off either side. Coming down, you have your inferior mesenteric, and we bifurcate into your left and right common iliac artery. Then it bifurcates again into your internal and external iliac artery, and it goes through the pelvis. Then we're into your femoral artery. Okay, so looking here, coming down the femoral, the one thing I want you to see is your popliteal, and then we bifurcate and we go into the anterior and posterior tibial artery. Okay, coming down, it goes into your medial plantar artery, and coming over here after we come through, so this is posterior, this is anterior, here's your anterior tibial artery. It goes into coming down your medial tarsal is pretty much what I'd want you to know. Looking here, this is a CT angio. We have a, coming down, once we bifurcate, we have the left profundus femoris artery. So you can see that when you're scanning an angio, and you have the left lateral circumflex artery that comes off of that. So coming down, this is your femoral artery. I don't really make you know the profundus artery. All right, so you have your popliteal, so it comes down your femoral, goes to your popliteal, and then it bifurcates into your anterior tibial to your posterior tibial, and then it bifurcates again into your fibular artery. And you can see some contrast in this posterior tibial, and not great though. So this is your venous system. So coming back up, you have your femoral artery, and coming up your femoral vein is the opposite. So we go to your common iliac vein up through the IVC. So this is a great picture to show you the nerves that are affected. So when a patient has what we call drop foot, where they can't raise their foot up when they walk and they trip and fall and usually break a hip at that point, it's usually coming from the low back. So kind of cool. So that is the end, the very end. That's it. So you have gone through the whole body at this point. So study up. Good job. I'll see you in class.